All right, we are going to start a new series on this page, the CPK Association. We're here with our researcher and developer, Dr. Milton Dowty. We have a few topics that we're going to discuss over the next few weeks. And really the big thing that we wanted to discuss today is our name is CPK, ChiroPlus Kinesiology. We're going to talk a little bit about how that started and our kind of, I say, newer vernacular is biosystems integration. And that's the technique that we're doing. That is the system that we are doing. And kind of talk to us a little bit about kind of how that started, how that shifted over the years, and how you just developed that.
Okay, well, in the beginning, we were chiropractic and still are to some extent, but back in the 70s, a growing technology called kinesiology came into being. It was a little bit competitive to the chiropractic picture because those who were chiropractors were manipulating and adjusting the spine. And here we have a system that analyzes, modifies, and corrects, and optimizes muscle performance that moves the bones. So when we test and evaluate muscles, we probably have 35 factors that are possible impairments to a muscle's performance. And so normal muscles move the joints in a normal fashion, and it maintains them in their integrity. And there's a little bit of competition there in what we're going to be doing with the joint itself. As the popularity of kinesiology grew, we kind of drifted farther and farther away from the adjustive, manipulative perspective, and we began to integrate some other things that were helpful to identifying defects in muscles. A lot of this was acupuncture related. Some other sciences came into the picture too that we'll try to discuss at some point in time.
Yeah, absolutely.
Of course, we have the nutrition and the toxins and the allergies and a variety of things there, and then the psychosomatic elements.
Yeah.
And then, so it wasn't too long we began to see this broader scope of things, and voila, we came up with the acronym SCOPE, so that we were analyzing structural defects, chemical imbalances, organ defects, and psychosomatic effects, and then, of course, the electrical composition of the body and energy components of the chi, as well as neurological integrity. And we had to change the name to be a little more appropriate, so we changed it to biological systems integration, or in short, biosystems integration. There you go.
Yeah, so let's go back a little bit, because in kinesiology, it's really the study of muscles and movement. So as you said earlier, muscles move bones, right?
Yes.
And so, as this system comes into play, we are working on the integrity of the muscle, right? And so, can you kind of explain a little bit more in detail of that scope system, right? Because we are looking at why is the integrity of the muscle not working optimally?
Okay.
Right?
Yes.
Yeah.
We have intramuscular defects. That would mean that if you got some kind of trauma to the arm and say the biceps, just for example, you might bend the fibers. And the fiber nature of contractions in muscles was discovered in 1950 by two doctors having the same name, even though they were across the ocean from each other, Huxley and Huxley. But they both discovered that it's a sliding filament principle as how muscles shorten up and extend. And so, yes, if you have some kind of trauma, it doesn't have to be great trauma. In fact, the flick of a fingernail can actually damage a muscle. And so that little deviation there can stop the ability of the muscle to contract properly. And so that's an intramuscular defect. The chemistry within the muscle can also go bad to where the ions of the different chemicals do not perform their job of activating the proper fibers for contraction. Sometimes there is toxic elements in there, like we hear of lactic acid, that creates an element that interferes with the function of the muscle. And then we can have the external problems, which are an enormous number of things outside of the muscle that can interfere with its integrity. we usually are thinking of like neurological components. There is peripheral neuropathy where somewhere within the body, close to the periphery of the body, there is some interference like a carpal tunnel entrapment. Or we could have a vertebral entrapment, which would happen at the spine. And yes, there's things that happen inside the spinal column, like a dural torque or meninges or inflammation of the meninges that we call meningitis. All of these areas, plus the cranial nerves, yeah, you get the picture.
Yeah.
It gets pretty complicated as it expands, and those are just hitting the surface levels of it.
Yeah. So when you were first starting out and doing some of your work and early on in practice, and you start seeing that there's more factors to what can affect this muscle, right? Or what can affect the integrity of the nervous system of just more than straight chiropractic. Kind of talk to me a little bit about, again, yes, CPK, ChiroPlus Kinesiology, but you just figured out that there's more to these things, and how did that kind of come about over the years?
Well, to be quite honest, I had a few. I'm a little bit OCD.
Yeah.
Yeah, you think?
Yeah. I don't think I necessarily call it OCD. I think you're curious.
I'm curious, and I'm very meticulous about how I do things, and so I had a fear factor of failure, and so I'm confessing a bit. And so I developed what I call a no more excuses practice, in that I had backups for backups for backups.
Yeah.
So that if anything tended to fail me at any point in time, I had a stream of contingencies that I could test and check on and try to bring into healing, the total picture of healing. And so I don't know where you want me to go with that, but yeah, I started something that I called a no more excuses practice. I kind of promoted that to everybody I was teaching. I said, look, you got to be diligent, almost a warrior mentality to win this battle against pain, sickness, and disease. I don't just want to go along and flow along and kind of pamper you to make you appreciate your pain or learn how to deal with it. No, that was not in my vocabulary. I was very adamant about conquest and conquering and curing and whatever other word you want to imply there. But I have a need for winning.
Yeah. Well, I think the system really embodies that, because there's always stuff changing, even take the last few years, for example, there's been new things in our world, and, how do we fix that? How do we change that? How do we get more optimal, And so I think it's a constant ebb and flow. And so being able to find this system, okay, we have the kind of basic, processing system here in BSI, but it always is ebbing and flowing in what we're fixing and what we're changing and what we're finding. I know from experience, I see him work in the office, and we just even he came up with some new things to work on just 2 days ago. And so he's constantly curious and constantly changing, which is amazing. And so, I think with that, and just to kind of wrap, bring it back all together again, the muscle integrity, that scope factor, we're not just working on the physical component of that muscle. We're checking those 5 factors each time, each spot that we're working, really, truly, right?
Yeah, absolutely.
Yeah.
Each point that we go to has to have a local analysis to find out what tissue right here is compromised. And then you have to ask the question, well, is it just a local phenomenon, or is there a contingency factor, some remote influence that is interfering with this portion of the body to perform its duties? And an intense amount of curiosity is there, as well as an observation, an ability to be seeing with eyes that see and hearing with ears that hear. And
being a doctor.
So when the patient comes in, and even before they sit on my table, I'm kind of listening to their chatter, and a lot of times they will, without even realize it, spill out a very articulate comment that takes me directly to the point of origin in their system.
Yeah.
and or at least where to jump in line and start examining, working our way either towards the symptom or away from the symptom towards a point of cause and effect.
Yeah, I think this system is really just an exploration. I always know, I might be going in with one idea and the system's going to take me in a completely opposite direction
Oh yeah.
in some cases. And I love that part of the system is it's an exploration where we're trying to get down to why this person is having this problem.
Over the years, you'll get a lot of experience and you'll get to thinking, yeah, I've been there before. But if you're always right, you better question if you're following the system, because the system is going to go, yeah, gotcha. We're going over here.
Yeah. It keeps you humble, I always say.
Absolutely.
Which is the beautiful part about the system.
Yeah.
We were talking earlier, and why we kind of call it this biosystems integration. It's more than just chiropractic. We have a lot more practitioners that do this technique now, and
with different titles.
Yeah. And when did you kind of see that coming in? Did you see that right away of everybody kind of being a little bit more open to it, or when did you kind of see that?
That started, I'd say, about the year 2000.
Okay, yeah.
We started attracting. I had just a couple of medical doctors that were really intrigued by it, and it doesn't really fit into their world, but they learned how to resonate.
Which we'll talk about that in a later
someday.
Video.
But anyway, it's a means of detecting cellular defects or cells or tissue that's in distress. That's all I can say right now.
Yeah, exactly.
Without getting started. But
Yeah, but we wanted to use that word integration because there's so many different avenues that you can take this technique.
Absolutely.
Yeah.
And there's
we have massage therapists and other practitioners as well.
Well, not so many massage therapists because of the educational background required.
Truth.
We do have acupuncturists.
Yep.
We have naturopaths. We do have some osteopaths, a few medical personnel. But it is largely chiropractic in nature because we're structurally oriented in the beginning. And it's a conservative care system. It's very diagnostic in that we can identify what tissue is in distress. That's huge. And each tissue has a type of protocol.
Yeah.
To fix a muscle is not the same to fix a ligament.
Yeah.
They're quite opposite. Ligaments get overstretched. You got to compress them to reset them. A muscle that's got a deviation in how the fibers align, you stretch that spot to realign it. And we go on down to herniated discs. I don't know, they did a kind of an in-house survey on my patient records, and there was a time where I was fixing 200 herniated discs a week.
Oh, wow.
And I still do a lot, but not that much. But I just looked over there. I have an article that I was just shuffling papers, and it says 30% of herniated discs are missed by MRI.
Uh-huh.
Well, that's where we come in.
Yeah, absolutely.
Because our system will identify them. And we're going to talk about later how that the position of the body exposes different types of defects.
Yeah.
And how is an MRI done? Laying on your back.
One position.
Yeah, it's one of the least offensive gravitational effects on the body, and it doesn't show the defect. You have to do something that enhances the gravitational effect to show the defect.
Yeah.
And do I stop there? I think that's a good place to stop.
I mean, I do think it's great. We're going to be having a lot more conversations with Dr. Dowty here, and he's just a plethora of knowledge. And obviously, he's the developer of this system, and we want to pick his brain as much as we can. And so, Doc, thank you for your time today, and you'll be seeing him a lot more on this.
Well, thank you.
Absolutely.
Yeah.